Hello, my name's Todd Baker. I'm the Training Education Director for Southeastern Emergency Equipment. Over the next few minutes, I'm going to go over the operation and functionality of the Philips on-site automated external defibrillator, or AED. That's probably the last time you'll hear me say automated external defibrillator. I'm simply going to refer to it as an AED from here on out. The Philips on-site is the most commonly deployed AED in the United States. It would not be uncommon for you to find one of these devices in an educational facility, a mass gathering area, athletic events, a gym, place of worship, or any other setting where AEDs may be deployed. A couple of disclaimers as I go through this. I will not be wearing gloves. You should certainly have personal protective equipment on if you were to use this device in a real event. And you may see when I open this that the pads themselves are expired. That's purposeful. I'm using expired pads for demonstration purposes as we go through this. So I'll start by showing you the unit. On the outside, it simply unzips, and I will go over what's in here in just a minute. I simply want to show you how you unzip it there. On the back, you can either insert a business card of your own, or whoever sold you the unit with Southeastern Emergency Equipment, you can put their business card there as well, so you'll know who to contact in case you have a question. So we'll come back around on the front of this. I'm going to open it up and basically just walk through what's in the device itself, show you some of the buttons, what they do, and then I will demonstrate the device in a simulated situation here with our simulator. On the top, you see a pair of scissors. These are for cutting clothing. You don't need to get the clothing off of them. You simply need to bare the chest, and that includes shirt, undergarments, anything. You need to have a bare chest before you can use an AED. Right below that, we have a quick reference guide, which is a simple 1, 2, 3 operation. Will remind you how to operate the unit if you forget. I think you'll find that it's very simplistic to operate, and you probably won't find it necessary to use this quick review guide here. The unit itself is held in this bottom area here. It's simply held with Velcro. You don't need to take it out for any reason unless you wanted to change the battery or perhaps get the serial number off of the back. To use the unit in real life, you would use it from a situation of laying flat, as you see here. As you come around on your upper right, you see a green button, and you also see a word that says pull on this handle, and that's designed after a fire alarm pull station. You can either pull this handle down to get it started, or you can press the on-off button. Either one of those do the same thing. It starts the unit. There's a blue I button right here. It has a couple of different functions that you'll see as we go through the in-service. The orange button with the lightning bolt is to deliver a defibrillation. If you need to defibrillate someone, it will be flashing and you'll hear a tone, and it will be telling you to press the flashing orange button. As far as warranties for the unit goes, the unit itself has an 8-year warranty. The battery is warranted for 4 years, and the pads themselves are warranted until they expire, and that's going to be around 2.5 years. It is incumbent upon you to keep up with the expiration date on the pads. That's the one thing that the unit cannot check for you, so there's no way it would know if the pads are expired. So it's a good idea to delegate that task to someone within your company so that you can keep up with whatever that date is. On the back, I've showed you one time. I want to go ahead again and show you where the battery is kept. It's a lithium-ion battery. Again, warranted for 4 years. You're probably going to find that it's good for probably about 5 years on average, depending on use. So before I put the unit back in the case, I'm going to show you a couple of things in this little garage area that I like to think of it as. Simply held down with a couple of little Velcro tabs here. But if you have an extra set of pads, they're housed back here. The unit has one set in it. There's another set back here. And there's also an extra battery. If you purchased an extra battery, there's a place to have that housed in the back here as well, in this little garage area. So I'm going to go ahead and put the unit back in the case and go over the actual operation of it. You would use it from this position. As I mentioned earlier, it's not necessary to take the unit specifically out of the case. We would use it from this position right here. For demonstration purposes, I'm going to hold this up to get it started, and I'll simply lay it down when I get the pads out. Again, you can push the green button. You can pull down on the handle where it says pull to get the unit started. I'm going to go ahead and pull down on this handle, and I'm going to go slow so you hear all of the voice prompts. Keep in mind that the quicker you get this done, the quicker the unit will begin analyzing. So it will keep up with the speed that you're operating.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So the unit will give you a couple of seconds to do that. Again, we would cut the clothes from the chest. Hopefully someone's doing CPR.
When the patient's chest is bare, remove protective cover and take out white adhesive pads.
We simply peel this down.
When patient's chest is bare, look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
So there's two pads that are placed back to back against this yellow plastic liner. There's pictures where they go.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So we have one pad in place. I'm going to peel the second one.
Look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Press pads firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
So we need to make sure no one's touching the patient.
Delivered.
So we'll say
Shock
clear.
now.
Everyone clear.
Press the flashing shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So if you wanted help with CPR, we can press this flashing blue button and it will tell you how to do CPR. Even if you haven't had a CPR class, you should be able to hopefully get chest compression started. I'm going to show you what that sounds like.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So we would be doing compressions. It gives you a metronome, so you know to keep up with that. This is 100 times a minute. The current Heart Association recommendation for chest compressions is 100 a minute at least. I'm going to let it run through one cycle of this so you can see what it will tell you.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Okay, so the unit's going to run through that for 5 cycles or 2 minutes. Then it's going to reanalyze. If you need to deliver a shock, it will tell you as such. You'll push the orange button again and resume with your CPR. I'm going to go ahead and turn this off. The last thing I'll show you is that you can't turn it off by just pushing the button.
Tilt head.
You have to hold the green button down to turn the unit off. I would strongly recommend that you not turn this unit off in a real situation. You should never turn the unit off or take the pads off. It's not uncommon for victims to go back into cardiac arrest. You may need to shock them again. So please leave the pads in place, leave the unit on, and allow the emergency services personnel to come and remove the unit once they get there. So when emergency services gets there, they're going to take the pads off and move your unit out of the way. These pads would not be compatible with any type of unit that's being used in the emergency services world. So they can't use your pads regardless of what type of unit they're using. So I'm going to go ahead and take these off and show you that this would basically just slide out of the way and they would then take over with their resuscitation efforts. So you'll be left with something that looks a bit like this after an incident. All you need to do is take this unit out of the case. There's a latch on top right here that you just slide over and this cartridge will come out. Just like this. All of this stuff is disposable. The pads, the cartridge, the liner, simply throw it in the trash can. It does not need to be disposed of in any type of biohazard manner. Just simply throw it away. So you get your new set of pads. Simply pop them into the unit, and it's ready to go.
In case of emergency, press the green on-off button.
So we would then simply place the unit back in the case, make sure it's not damaged in any way, zip it up. You can put it back on the shelf or in the case, and it's ready to go. All right, now I'm going to go through the daily checks, the troubleshooting, and talk a little bit about maintenance of this unit that you would need to do, which is not anything really, but I'm going to address it simply because some people think that you do need to do periodic maintenance. So we'll start with a daily check of this unit, and the daily check is to simply look right above my finger here and make sure you see a green light flashing. Now it may be a bit difficult for you to see on the video. It's really not important, but there's a little green light that flashes about once a second. And if I put it back in the case here and put this down, you'll notice that there's a little window right here for you to be able to look through and look for that green light flashing. If you see the green light flashing, it's ready to go. So there is no end user maintenance that needs to be done to this unit, yearly, monthly, weekly, or anything else. The unit does over 80 self-tests every day, and as long as the green light's flashing, it's ready to go. If the green light is not flashing, you will hear a periodic chirp, and that will alert you that there is something wrong with the unit. I'll show you what that sounds like.
Insert pads cartridge.
So now you hear the periodic chirp. Certainly it's chirping now because I've removed the pads cartridge, but any chirp such as this means that there's something wrong with it. If you can remember to push this I button, it will tell you why it's beeping.
In case of emergency, press the green on-off button. No cartridge installed. Insert pads cartridge.
So in this instance, again, it's beeping because I've taken the pads cartridge out.
Adult pads. In case of emergency.
Now the most common reason that any AED would be chirping is because of a low battery condition. If that's the case and it tells you it is a low battery condition, simply give us a call, give your sales representative a call, and they can get you another battery. You still got about 15 to 20 defibrillations left on the battery after it starts chirping. However, that can be annoying. Please do not take the battery out of this unit, put it back in the case, and close the door to make it stop chirping. That is not the appropriate way to handle an AED that's making noises. If it's chirping at you, there's something wrong with it, so it needs to be addressed. Please feel free to give us a call if you don't know how to do that, and we'll be happy to walk you through the steps. You may also take the battery out of the back. This simply comes out. And if you leave it out for 10 seconds and put it back in, the unit will begin a battery insertion test. It's very simple to go through. It's simply going to tell you to push the on-off button and to push the power button. Then it will say testing several times and tell you if there's a problem, and you can address that based on what the unit itself tells you that it's finding. So that's pretty much the operation of the unit. We've covered how to use it, any type of maintenance issues, troubleshooting issues. It's a very simplistic unit to use. I think you'll find that if you do have a situation, it will work well.